Hello, this is Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide an update for Simcoe Muskoka about COVID-19. So at this point, we've got a total of 713 cases. This is up by 25 cases since I last reported a week ago on August the 25th. And I think it's worth noting that this is a very substantial increase in our case count. We've not had a weekly increase of this magnitude since June the 21st. In that week, we had 40 confirmed cases, so this week having 25 is certainly less than that, but you have to go back to June the 21st before you get that kind of a jump in cases in a single week. If you look over the past day, we've had 5 cases, and over the weekend, we had 6 cases. So of the 5 cases that have occurred in the last 24 hours, 3 are male, 2 are female. Their ages range from teens to 70s. All live in Simcoe County, 3 in Barrie and 2 elsewhere in Simcoe County. All are sporadic cases, all are under investigation, and all are self-isolating at home. So just a little further reflection on how our case counts have changed over time. I've mentioned it's been 25 cases since I last reported. If you look at the week of August the 23rd, we had 22 cases. The week before that, we had 11 cases. The week before that, we had 4 cases. And then the week before that, we had 7 cases. So we're definitely on an upward trajectory at this time. We've also got 2 outbreaks in long-term care facilities. Both involve a single staff, and neither of them have any residents at our cases. I'll get into more information about that in a moment. We've had a total of 642 cases that have recovered. That's 90% of our total. We presently have 1 individual who's hospitalized and nobody in the intensive care unit. We've had no additional deaths, so a total of 37 deaths. And if we look at our trajectory over time, our weekly incidence of cases is 3.7 cases per 100,000 population, compared with 2.4 cases per 100,000 population in the preceding week. If you wanted to compare with provincial numbers, we're still below the provincial average when it comes to the weekly incidence. So during the week of August the 23rd to the 29th, the provincial incidence of cases was 5.9 per 100,000 versus our 3.7. So we've come up, the province has come up a bit, we've come up relatively speaking more, but we're still below the provincial average. I'm also going to give a little bit more information with regards to our outbreaks. So one of them is Mill Creek Care Center in Barrie, declared on August the 24th. I previously reported on this one. 1 staff member, and so we're considering the residents on the 2nd floor to be part of the outbreak, where that staff person had worked. And all of those residents have been tested, as well as all of the staff in the entire facility, and they've all come back negative. There was no breach in infection control in that situation, so we will continue monitoring the situation and keeping the control measures in place. What's required is no additional cases for a 14-day period from the onset of the outbreak, so we have another week or so to go. Our second outbreak is at the Pines Long-Term Care Facility in Bracebridge, which was announced by the facility yesterday. It was declared on August the 30th. 1 staff person, no infection control breaches. With the assistance of Muskoka paramedicine, we are testing all of the staff and all of the residents at that facility. So we're awaiting the outcome of that testing, and of course we will keep in place all our control measures. So We are a week away from the opening of schools, which will take place on September the 8th. And so much preparation is being pursued, has been pursued. We continue to pursue it. We continue to work closely with our school boards. We're building up our own internal team and hiring staff in order to do our part to protect the schools. We received the province's outbreak guidelines a week ago on Wednesday. Actually, there were two guidelines. One was from the Ministry of Health to guide public health units, and the other was from the Ministry of Education to guide schools and school boards. We are coming forward within the next 24 hours to our school boards with our own local version of the outbreak plan that's tailored to our local needs and the needs of our school boards. And we'll be communicating that information by a health fax to our healthcare providers in Simcoe, Muskoka as well. We've been keeping them informed along the way as to what's been happening with schools, and we'll continue to do so. And that health fax will provide information about expectations for healthcare workers for attending primary care providers. So just a few details I think that are important for parents. In addition to the letter that we provided to all parents and the online engagement that we've done with an online town hall meeting for one of the school boards with some 15,000 people attending last week, we have more information for you. So I'm just going to provide you with the following. This is with regards to self-assessment. So one of the safeguards in our schools is that parents would assess their children each morning in order to determine whether or not they have any of the symptoms of COVID-19. And if they have any of those symptoms, that they should not send their children to school and should report this to the school and should fill out the online form that the school is going to be putting out. We as a health unit are also going to be providing an easy paper version to be circulated to parents so that if they don't have good access to the internet, they can use that. If they prefer that, they can use it as an alternative. But if in fact they fail the test, then we are recommending that they would seek assessment and probably testing, although that would depend on the details of the situation. So we have the following for you. Children and staff who have any symptoms that are consistent with COVID-19 persisting for more than a few hours and for whom the symptom is new and not related to seasonal allergies or pre-existing medical conditions must stay home from school and should be tested for COVID-19. So if the results are returned as negative, then the students or staff or essential visitors for the schools are able to return to school within, 24 hours after the symptoms have resolved. So if you have a negative test and then your symptoms resolve, 24 hours after you can return. On occasion, a parent, guardian, or staff or visitor may feel there is another explanation for the new symptoms requiring medical assessment rather than a COVID-19 test. In that case, they should contact their healthcare provider as usual. If the healthcare provider makes an alternative diagnosis and determines that the condition is not COVID-19, they may indicate that the individual can return to school when free of symptoms for 24 hours. If the individual is not tested for COVID-19 and there is not a clear alternative diagnosis, then they will need to self-isolate at home for 14 days or a full period of communicability so that if in fact they do have COVID-19, they're no longer going to be infectious when they return. And of course, they need to be symptom-free as well when they return. And then finally, medical notes or proof of negative tests should not be required for staff or students to return to school. This is our recommendation at this time. Although I would note that school boards are still looking at this question and they may decide otherwise. They might decide that they need such, but at this time, our recommendation is that they wouldn't need that kind of a letter. So what will happen to students who are ill at school? Okay, so if a student starts to develop symptoms of COVID-19 at school, they need to be separated. The teacher needs to be made aware of this. The student needs to raise this with the teacher. If the teacher notices it, they need to take action. So they need to separate the student from the other students and other individuals, ideally put them in a designated room, and notify their parents for the parents to come and pick them up. And then the parents should be, and this would also apply to teachers as well, or any staff on the premises or any visitors, that they need to be separated and then returned home for follow-up. So, of course, from there, it's a matter of referring yourself or the sick individual for your follow-up assessment and testing. So what will happen if a student or staff tests positive for COVID-19? What will we be doing? Well, the health unit will be made aware of this immediately, because the public health laboratory system notifies us in short order of positive results, and we respond within a 24-hour period to all cases in order to assess them and assess their contacts and put contacts in isolation for follow-up and for testing. So with regards to this happening in a school setting, we would be following the recommendations from the province about school outbreak management for COVID-19. So this includes identifying and excluding the contacts. So this also includes the cohort of the students. So that would be their class. That would be if they're on a school bus, those that they're on the school bus with. If they're in a before or after program, those that are in the before and after program. If they belong to any extracurricular activities where they've had contact with individuals, they too would be excluded, be sent home for isolation, and we would follow up with them as contacts in order to advise them further about the need for testing and continued isolation. There's the recommendation for increased environmental cleansing or disinfection that would take place related to this. There would be testing for the contacts, staff and students, including those who don't have symptoms. And we would put in place enhanced surveillance, looking for additional cases in the school that has been affected by this. So a question about how do we define what an outbreak is. We define an outbreak in accordance with the province's protocol of 2 or more laboratory confirmed cases of COVID-19 in a school where there is a link, an epidemiological link between the cases. Within a 14-day period of each other. That link is important because it's possible that you could get a situation where you coincidentally have 2 cases that contracted their infection elsewhere, not in the school. So part of the case definition is some evidence that they contracted it in the school, not that they contracted it out of the school, and that there's no evidence that they had infected each other via the school. Some information about non-medical masks or face coverings in schools and personal protective equipment. The province right now has recommended, required that children in grade 4 and above wear their masks throughout the school day, with the exceptions of when they're outdoors at recess. Or for other reasons why they're outdoors, and those would be good opportunities for them to get a break from wearing masks. And that children under grade 4 be advised but not required to wear a mask. We are finding that there are a number of school boards that are looking throughout the province at, or in fact some of them have decided to go ahead and require mask use in younger grades as well. So we're in discussion with our school boards about this, but I've actually gone on record as personally supporting the province's perspective on this. Part of the reason why is because we have relatively, even though we do have an increase of cases at this very moment, it's still below the provincial average. It's been relatively low. I know that there are other areas in the province where they have a higher incidence or have had a higher incidence of cases that have decided to go with a more stringent approach in requiring mask use at the younger grades as well, perhaps from grade 1 and up. The Ministry of Education has required that staff in school require medical masks and eye protection. So a higher degree of protection for employees. And actually, adults are at a greater risk of contracting this infection and having serious consequences. So hence the greater requirements for employees. And as I'd indicated before, the masks are not required when individuals are outdoors. But we would stipulate that they need to continue distancing as much as possible. This is, the use of masks is just part of the profile of protection. And we know that indoors in schools, it can be challenging to achieve 2 meters of distancing, but where possible it should be done. And certainly outdoors it should be done. We also note at this time that there's a great deal of stress associated with this whole situation. And it would be helpful for us to remember that it's a good time to exercise compassion for each other and to attend, I guess, to each other's anxieties about these things and to seek not to be judgmental of people's choices. People may make different choices from other people about whether they be sending their children to school or for the younger grades, whether or not they would be using masks, and whether or not they'd be doing remote education instead. So I think it's important that we all respect each other's choices and have compassion for each other at this time. We do have information on a website to help address questions that you might have related to return to school, and we have our Health Connection line as well that is a good resource for people as well. Certainly we've had a tremendous number of calls over time making use of that resource. We've had over 12,000 general inquiries on our COVID-19 line during the first 6 months of the pandemic. We've also investigated 15,600 persons as contacts for COVID-19. And 257 child care investigations as well, not having had any transmission in child care settings, but a lot of individual investigations. So just taking a moment to point out the amount of contact we've had with the community, and we encourage that continue. So our media questions are as follows. Regarding self-screening protocols that parents and guardians are being asked to do with their children, what is self-screening? What should a parent be looking for? When does a parent make a call to have their child sent for a COVID test? So this would be in line with some of the information I've already given. And the schools will be making available an online tool that you can use. And we will be providing a paper-based tool that you can use, but it's basically the same content that the province has provided all along for people to be self-screening, looking for any one of the symptoms that can arise. They're all respiratory type of symptoms, so a cough, shortness of breath, fever. You can have inflammation of the eyes. You can have a loss of smell sensation or taste. You can have a general fatigue. You can have, in particular children, some skin changes, particularly in the toes. So there's a wide range of symptoms, and they're all listed on the ministry's tool. Even nausea, vomiting, diarrhea are symptoms as well. So very, very wide-ranging symptoms, and basically it comes down to if your child has an illness, that consideration should be made that they may have COVID-19, and therefore parents need to be erring on the side of not sending their children and seeking assessment in follow-up. We've made this slight modification about it being a symptom that would not be just for a short time if it's persisting more than like an hour, I think, then people need to be excluding their children from school. So more than a few hours is what we've got in our wording, which we'll include in our tool. If it turns out that they've got an ongoing medical condition, well, I think like allergies, if the first time around, you're going to need an assessment, contact with your attending physician in order to be sure that this is the same thing, to get a determination of whether or not a test needs to be done that first time, to be absolutely sure. So that would be the call of your attending primary care provider. But otherwise, if in doubt, really we would be recommending that you would seek assessment for testing for your child, or if it's a teacher, for the teacher. What is the Health Unit recommendation about students bringing with them to school in terms of masks and sanitizer and school supplies? So I'm actually going to get my school health team to provide a good list, and we'll put it out to the media so that you've got it. But for sure, a small container of hand sanitizer would be a good thing to take, alcohol 60% or above, and I would think that more than one mask is going to be needed to get through the day, so 2 masks anyway, because they can easily get soiled. But we'll get a comprehensive list for you. Would it be possible for Dr. Gardner to provide an overview of the recent test numbers over the last few weeks in Huntsville and Bracebridge Assessment Center sites? So what I can say is, if you have a look at our website for our case counts, and you go down to COVID testing, you're going to see that we were keeping up well, both in Simcoe and Muskoka, up until the week of August the 10th, and then there was a marked drop in testing results that we know of, that were reported to us for Muskoka for the weeks of August the 17th and August the 24th, down. When it was up where it was following the provincial rate, along with Simcoe County, it was 116.8 tests per 10,000 population per week, which was just slightly below the provincial rate of 124. And then for the following week, it dropped down to 50.1, and then the following week it was 50.3. So dropped in half, less than half of what it had been. And we've been making some inquiries with the assessment center. We don't have a clear answer for this, actually. So we're going to continue to investigate that. But at this time, I don't have a good answer for it. It is puzzling. I do note that in Muskoka, they've now changed so that they only have one assessment center, but that was as of the end of August, and so that wouldn't be an explanation for why these numbers have dropped. These dropped before that took place. They have only one assessment center now in Muskoka, but people can also, if they can't get to that assessment center in Bracebridge, can ask paramedic services for Muskoka to arrange for a test for them. So we still have that option as well. So that brings me to the end of my presentation. I'd be happy to take any questions.
Okay, thank you, Dr. Gardner. Let's start with Muskoka. James Bowler, do you have a question for Dr. Gardner?
Yes, I do. Thank you. Dr. Gardner, I just wanted to address this spike that we've suddenly seen in Muskoka. And we've had a few discussions about people coming to the area and being infected and then going home again, and those infections not being reported here. Is it appropriate to tie this recent jump to the possibility that this has been brought in from out of the area?
Well, I think in a very simple sense, all COVID-19 has been brought in to all areas. So for sure, the migration of people with COVID-19 is what leads to its spreading, and then from there, close contacts. The cases that we've seen with the past 2 weeks where we've had an increase have been linked largely to family clusters. So in the past week, we've had 4 family clusters in the Barrie area, and then 1 in Simcoe County, elsewhere in Simcoe County. And I think the takeaway message in those instances is that people need to be very careful. Even with family members, you have to be careful and stick to your social circles of 10 people, not have large family gatherings, or not move about and have close contact with many family members, because that's how we've seen our transmission happening. I know that that's completely contrary to people's nature and people's needs. We want to have direct contact with family members, and I think by all means you need to see them, but unless they're in your circle of 10, and it's the same 10 people all the time among all those 10 people, the others, you need to keep your physical distancing happening. See them in your backyard with a 2-meter distance. In Muskoka, we've had 3 cases recently. They haven't been linked with each other. They haven't been part of a cluster, and they therefore are really being considered. 2 of them, at least, are being considered as community acquired. We don't have a direct link between those cases and the concern that had arisen earlier with the family gathering cases that had happened at Deerhurst, or 3 Men and a Stove, the cases that are actually took place out of district but had gathered here. We've had no link between that incident and those cases, not that we know of.
Okay. I do have one other question. I just want a cheeky quick follow-up on that, local cases. Was there any identification on how the worker at the Pines was infected?
We do not know.
Okay. So my second question was to do with the nurses that are going to be helping in schools. Do we have an idea of how, and I don't know if this has been asked already because I haven't been on the call in the past couple of weeks, but do we have an idea of how many have been hired for Simcoe Muskoka specifically, and how will they sort of be divvied out?
So the provinces originally gave us support to hire 20 nurses, and then with federal funding added to that, it's up to 26. And we recently had some, we just had good support, I would say, to proceed with that. So we are proceeding. We are posting these positions. We're seeking to hire them as expeditiously as we can. And while we're doing that, we're reallocating staff within the agency to be on our school health team, so that we will have 7 ready to support our schools on the 8th of September, and then more coming as we hire staff. And in addition to that, we have 20 staff who do case and contact management, who will do the case and contact management for any cases that may arise in our schools. So quite a few to hire. We've done some internal reallocation and reorganizing to do our best to be ready.
Thank you very much.
You're welcome.
Okay, thank you, James. Dawn Huddlestone, are you on the phone? Okay, how about Alison Brownlee from Muskoka Region?
Yes, thank you. Good afternoon.
Good afternoon.
First question, we seem to be getting pretty prompt confirmations of confirmed COVID-19 cases from businesses, from our long-term care home, from the rumor mill in the community, before the health unit confirms publicly that there's a confirmed case in our area, Muskoka specifically. Why does that delay exist?
Well, for one, those businesses have actually chosen to go public. And we normally wouldn't even be releasing the information about those businesses themselves. Certainly if they choose to do so, that's great, but we otherwise wouldn't be releasing that location. We'd be indicating that there was a work-related case, but we wouldn't be indicating which workplace unless it was necessary to give that information to protect the public. So if we, in our investigation, have contacted all the contacts of the cases, all the close contacts, then We don't give out the name of the facility itself. We only do so if we feel that we can't get to everybody and we have to do it through the media. We have our media presentations on Tuesdays. We are available to provide media contact through the week, Monday through Friday. Normally we aren't doing that on weekends. Partly to be able to sustain ourselves through the entirety of the pandemic. That's a decision we made fairly early on and have kept that decision. So if those facilities choose, like for example, the Pines, if they choose to put out a press release at the evening, the day before we can have our media scrum, they've made that choice. They've done so a day in advance of ourselves. Certainly, we are prompt in following up with them in the management of the situation and the identification of everybody to be isolated and tested.
Thank you. The second question that I had was regarding assessment centers in Muskoka. You did note that we're down to one assessment center in Muskoka. We did have the 3 cases announced in our communities last week or on Monday. There's obviously concern about the long-term care home, obviously concern about schools opening up. Why not have public health lead the establishment of more assessment centers in the community instead of accepting that we have one central one now?
Well, we are a party at the table, and certainly we do encourage that we have adequate access to testing. The primary responsibility for having assessment centers established rests with Ontario Health, the central region, and in fact the actual on-the-ground support for having it happen has been between hospitals and primary care, sometimes with support from emergency medical services. So we've, along the way, always played a supportive role, not a role of directly operating themselves or directly opening them ourselves. So we can encourage, but we don't have primary authority or responsibility ourselves to do it.
Would you like to see more assessment centers open if possible?
I think we want good access for people to get tested, and assessment centers has been the backbone for that. And in fact, back in February, the first inquiries about setting them up came from my office, myself, in a number of instances calling up hospitals and primary care leaders to foment their creation. So we played that kind of a leadership role early on, and to me, I want to make sure that we continue to have sufficient access. We've got a fairly high density of assessment centers. In the central region, they've had 20 of them, and we've had between 7 and 9 of them, depending on the point in time in which you look at it. So we've had a fairly high density of them. At the end of the day, I think it's important that everybody have access. So what's really good is that people who can't get to that site in Muskoka can ask for testing to be done through Muskoka paramedical services. But if we could have more of them, it would be good.
Thank you so much. I really appreciate it.
You're welcome.
Thank you, Allison. Mike Arspedides from CTB, do you have a question?
Always. Doctor, you look refreshed. Nice to see you.
Thank you. How are you doing?
So I was just, I'm okay, hanging in there. I was just at the assessment centers, what they call it, Clinic C over at RVH, and they said they've had about 1,000 a week now, 200 a day. Would you recommend more people get the test, even if they are asymptomatic?
Well, we know that what we call the yield, the likelihood of having a positive test for a person who has no contact history and no symptoms, is maybe 1 in 1,000. And then even among those positive tests, we found that a good number of them, upon retesting, turned out to be negative. And then we're left with a question: were they a remote positive, where they'd been infected in the past, and this is just residual shedding virus that's dead, they're not communicable? Or was that a false positive? So in general, we've not found it to be that helpful for people who don't have a contact history and don't have symptoms to be tested. They have a right to be tested. The province has made it available for them to be tested, but we've not found it to be that helpful. If people wish to, it's their right, but we haven't found it to be that helpful. What's critical is that people who are far more likely to have a positive result have good access to testing with a rapid turnaround in their results. So that would be people with symptoms and people with a contact history. Certainly people involved in an outbreak, we would want those people to have very good access for testing and a rapid turnaround.
Okay, just a follow-up to that previous question my colleague submitted with regard to the supplies for school. So would you, because in York Region District School Board, they're saying don't bring the sanitizer, we're worried about scents, we're worried about sensitivity, we're worried about where you got the sanitizer and if you're making it in your grandma's basement. So you would still recommend bring a sanitizer as long as it meets the percentage requirement, small little container, and you would say bring some masks, because you don't want every kid wearing those same surgical masks and looking the same, and then the chance of cross-contamination and all that. But also in terms of school supplies, would you want little Pete bringing his case of pencil crayons, or would you suggest, lay off that for a bit to avoid any cross-contamination, any tactile things being infected?
I must admit I didn't know about York's recommendation, so if that's their perspective, I would respect it. I think, like I said, I would rather get this information back to you from my school team, because they'd be able to weigh this kind of consideration. And certainly the schools are required to have really good access to hand sanitation throughout the school, so anybody who doesn't have it with them would have access to it that way. And they're going to be making recommendations about what you do with your things. I'm sure that students are going to need implements to learn with, but what they bring would really be at the direction of the school to meet their needs.
So you wouldn't say, limit the things you put in a lunchbox. You wouldn't say don't bring your multicolored crayons. Bring what you would normally bring to school, or should we be extra cautious this time around for let's say the first month of school?
I'm saying that I'd like to take some leadership from the schools themselves. I'd like to get some thought from my own team to be able to answer that question well for you.
Okay, and with regard to those clusters, is this like what we were seeing about a month ago or 3 weeks ago in Huntsville, where that family from out of town stayed at Deerhurst Resort and 20 people gathering in a big social circle, and then we had one case at the restaurant there. Is this what we're seeing more often than not with regard to these clusters, and are these folks from out of town commingling with folks from Simcoe, Muskoka?
So I've had no indication from my staff that there are out of town people involved in these clusters. Nor have I been told that there was like an incident of some kind with a large party. It seems to be more that it's just people who have multiple close contacts among their family members, their household members, and beyond, but within the family circle. So not so much a big family gathering, but people who just associated multiply with others is my understanding. Whereas the situation you were talking about in Muskoka actually was more than one family coming together to form a large group at that resort.
Can I just ask one more? Do you think people are respecting the 10 per circle, or do you think people are, being a little liberal with that?
I'd like to have really good data on it. I know that we're seeking that kind of data at the province, survey data, to have a really good idea of it. So I don't have objective data about it. I do know that the numbers of contacts per case has gone up substantially since a month ago. It used to be around 3 and now it's 7. So that's an indication of people expanding their contacts that they have over what they had before. I think that's an indication that people aren't sticking within their circle. I certainly note people socially, it seems younger people, coming together to socialize out in the public on school grounds and stuff and such, not not physically distancing. So to me, I see some evidence that people aren't abiding by that ruling of 10. In my own life, I'm aware of people that struggle with the idea, that they find it quaint that I stick with it. They're not really sure what to do with the fact that I stick with it and they don't. So I have reason to believe that people are having trouble with it.
Thank you. I'm officially out of your hair. Thank you.
No problem.
Thanks, Mike. Andrew Mendler from Simcoe.com. Do you have a question for Dr. Gardner?
Yeah, just one quick question. I've noticed the 25 of the last 37 cases reported are in Barrie. Is there any reason for that? Is that linked to the family clusters that you've mentioned earlier?
Yeah, well, certainly in the past week, we've had the majority of our cases have been in Barrie, right? The family clusters have been in Barrie, 4 of the 5 family clusters. So it appears that right now Barrie is becoming more of an area in which we're seeing this happening, the transmission happening.
Okay, thanks.
Thank you, Andrew. Erica Engel from Collingwood Today. Go ahead.
Hello. My question is about the 0 to 17 age category. Looking at the data on the Health Stats website, it looks like for the month of August anyway, it's sort of relatively speaking higher incidence rate compared to the other age categories. So, there's more, it seems like kids testing positive. I just wondered if you could clarify if they're like kids or they're more on the teen scale, and if it creates any extra worry knowing that kids are going back to school soon, or maybe you know why there's more kids testing positive.
So generally speaking, it's been more teens than children that have been testing positive. And what we did note was in the last week or so, we've had more children as well testing positive. And I think your point is well taken about schools. This is not the best. This is actually not a good time for us to be seeing an increase in transmission among children. And it'd be all the more reason why people have to abide by their social circles and have their children abide by their social circles, and certainly screen their children before they go to school to prevent an illness occurring at the school and then transmission. So I think your point is a good one. I note that provincially there's been a lot of concern about a surge in youth cases. And if you look at that particular graph that you were referring to on our website, it doesn't really show a surge in youth cases over time. It just shows that cases among seniors and older adults have been dropping more than they have been among youth. So that the average age of our cases month by month has been going down because of that. But in August, it does indeed look like there's more youth than in the previous month. They're up, at 6 cases per 100,000 as opposed to the previous month 3.5. So that's actually an increase. We're actually seeing an increase in youth cases in the last month, and I think in particular in the last couple of weeks. The timing for that is worrisome, and we need to be on guard with regards to opening up the schools.
Okay, and I had one clarification with the outbreak management protocol you mentioned. You said that the health unit would follow up on close contacts, and that people in the cohort would be isolated. Would they have to stay isolated or excluded for 14 days, or just like what if they got a test and they had a negative result? Can they then come out of isolation?
Very good question. So any contact of a case has to be isolated for 14 days. It's recommended that they be tested as well. But even if they have a negative test, they have to remain in isolation for 14 days. And if they develop symptoms, we'll want to test for sure then and they'd have to remain in isolation until 14 days after the onset of their symptoms if it turns out that they become a case of COVID-19, and we would have to follow up with their contacts to put them into isolation. So in this situation with a school where you've got a case in a school and have the cohorts associated with that case sent home for isolation, they'd have to remain there for 14 days, possibly longer if they became a case.
And sorry, would that include the teacher in the cohort as well?
Yes.
Thank you.
You're welcome.
Thank you, Erica. Just checking to see if they're, Dawn Huddlestone, are you on the line?
I am. Sorry, technical issues at mine.
Okay, go ahead, please.
I do have a quick question, Dr. Gardner. It's about the COVID app, the COVID alert app. Are you hearing anything at your end about what the uptake has been like and whether it's been successful? We're hearing reports just recently, perhaps related to this new Huntsville case, of people who have been receiving notifications about exposure.
Good question. I have the app, and we've made it available to our staff, encouraging but not requiring that they use it, making it easy for them to download and put it on their device. Because I believe it's a nice additional safeguard for people in addition to the contact tracing that we do with all of our cases. This is an added protection to alert people if they've been in close proximity, 2 meters or less, for 15 minutes or more to a case of an individual who also has the app and turns out to be a case. I think it's important for people to know that they shouldn't rely on that. They've still got to be doing their physical distancing, their hand washing, their use of masks in indoor public places, the self-monitoring, self-isolation, and seeking assessment if they develop symptoms. You have to keep doing all of that and not rely on the app alone to do that for you. I actually don't have good data about the uptake of the app or how helpful it has been. I'll make a few inquiries and see if I can find out some information for you, but offhand, I've not heard any reports about it.
Great, thank you.
You're welcome.
Okay, is there anyone else on the line that we may have missed?
Actually, I've got a few questions, if I may. It's Brett Glover from Barrie 360.
Oh, hi, Brett, go ahead.
Well, thanks very much. Now, I'm a parent, and I'm pretty stressed about this whole back-to-school thing, but how impacted are our children, especially younger kids, by the anxiety and the stress that parents are understandably feeling right now? Is there any way to mitigate that stress as well?
I think it's important to admit to your child if you're feeling anxious about it, because they pick up on it, and to walk through with them your concerns. It would be important to become really well informed about COVID-19 in children and the nature of the risk. In fact, children are at a considerably lower risk than adults to contracting it, to having a severe case of it, certainly dying from it. There's only been one death in the province from COVID-19 among children. Among the more than 40,000 cases and 2,800 deaths that have happened in the province. Here in Simcoe, Muskoka, about 5% of our cases have been in children, but none of them have been hospitalized and we've had no deaths. So our pattern is consistent with the pattern internationally. Children can contract multi-system inflammatory syndrome, which may or may not be associated with COVID-19. That's not clear to us, but that is very rare and in most cases mild. It can be severe, but in most cases it's mild. So being well informed about the nature of the risk would be helpful, and then walking through with your child what they can do to reduce the risk. So supporting them and being good about using the masks and hand sanitization and physical distancing, and being mindful of those things, not just at school, but after hours as well. The social circle, the child's going to have a cohort at school, but then out of the school, they're going to need to go right back to abiding by that social circle of 10 people within your family. So doing what you can to support them in that. They do need to play, they do need to go out, But as much as possible, they need to be practicing the physical distancing while they can. I know that with children, that's going to be tough. It's going to be a challenge to achieve. But if you can empower them with knowledge and share with them your own feelings and why, at least you're giving a name to the feeling. They'll understand your anxiety instead of not understanding it, which can make it worse.
Thank you. And along the same vein, stress. Anecdotally speaking, we're hearing some folks have increased their alcohol consumption as the pandemic progressed, either out of boredom or that stress. They might find themselves with a substance abuse now. Is there something that the health unit is aware of that you're looking at, or are there any services that folks can rely on through the health unit as well? So
we have done a review on the harms associated with COVID-19 and our response to it, our control measures. We've done a literature review and availed ourselves of local data where we can get it. So that's up on our website. And what you'll find is indeed substance use is one of the categories of issue, including alcohol consumption having gone up over time. So domestic violence is another issue. General stress is an issue. And that children can also be affected by this, adults and children, with regards to the stress and the anxiety. People have been affected with regards to physical activity as well, restrictions on their ability to get out, and that can have mental health impacts. If people want to call our Health Connection line, we have general information about how to refer you to other services or people to other services for a variety of health-related issues. Telehealth would be another option. The Canadian Mental Health Association would be another option. Primary care, your own primary care practitioner may be able to assist people as well with such issues.
Perfect. Thanks for your time.
You're welcome.
Thanks, Brett. Is there anything else on the line we may have missed? Okay. Well, it's been a long one today. I'd like to thank you all for attending, and we will see you all next week.
Goodbye, everybody.
Bye. Thank you.